Are you ready? Okay. Hi, my name is Michelle. I'm a student from Chamberlain College of Nursing. I'm going to do a quick health assessment on you, and it should take about 15 minutes. Do you need anything before we begin? Do you need the bathroom?
No, I'm okay.
No? All right. Can you tell me your first and last name?
Ashley Snow?
Okay, and then can you tell me, do you have any allergies?
No.
No allergies, no food or seasonal allergies at all? Are you allergic to latex?
No.
No? Have you been exposed to latex before?
Yes.
All right, and nothing happened with that?
No.
All right, from a scale from 0 to 10, 0 being no pain, 10 being the worst pain ever, can you tell me your pain level?
0.
No? Okay, so no pain. So I'm gonna start with your general appearance. You look your stated age. Your skin color is, you have pink undertones, and it is appropriate to your genetic background. Your facial features are symmetrical. You don't look like you're in any signs of distress. Your body build is appropriate to your height and weight. Your nutrition is adequate. Your contour is symmetrical to your hips, from your shoulder to your hips. Your posture is erect, and you have no physical deformities. All right, now I'm going to ask you a series of questions. Just please answer them to the best of your ability. Can you please repeat your first and last name again?
Ashley Snow?
All right, and then Ashley, do you know where you are?
Chamberlain?
Okay, do you know what day today is?
It is Wednesday.
And can you tell me your reason for being here?
To record this video.
All right, so you are alert and oriented ×4. So your behavior is calm, your facial expressions are appropriate for the situation, your speech is articulate, your dress is appropriate for the weather, and you have good hygiene. So I took your vitals, and your vitals were 120/80, your pulse rate was 70, your respirations were 16, and your temperature was 98.6. Your pulse ox was also 100% on room air. You don't have oxygen with you. And so I'm gonna start with your skin and nails again. So your skin is dry, it is warm. I'm gonna do your skin trigger. So you have no tenting, you have no lesions, no wounds, you have pink undertones, no rashes, you appear to have no tattoos. So your nails, you have no clubbing and a capillary refill of less than 3 seconds. Now I'm going to look at your scalp. Thank you. So I'm going to palpate your scalp. So you have no bumps, and I see no lesions, no infestations. Your hair is evenly distributed, and there's no brittleness. So your face is symmetrical. Your facial structure is even, symmetrical. There's no drooping. Can you smile? Can you puff out your cheeks? Perfect. And then, so now I'm gonna check your eyes. So I'm going to do something called Perla. So I see you wear glasses. Do you wear contacts at all?
Yes.
Do you have any trouble seeing without your glasses?
Without them, yes, but with them, no.
So you wear your glasses normally?
Yes.
All right, so if you could just look at me. So your pupils are equal. They are round. They react to light. And then if you could look at the tip of my pen. Okay, and they accommodate, which is good. And then now you said you don't use visual aids, correct? All right, so I'm gonna check your ears now. Do you use any hearing aids at all?
No.
No. What do you clean your ears with?
A washcloth.
Washcloth. Perfect. So I'm gonna do something called the whisper test. So if you cover one of your ears, and I'm gonna whisper something, and just repeat what I say. Pizza.
Pizza.
Okay. Lasagna.
Lasagna.
All right. So the whisper test is turned up. Okay, so I'm gonna check your ears to see if there's any lesions or drainage. No lesions, no drainage, no discharge. Good, and your ears are symmetrical, and they are in line with your eyebrows. So now I'm going to, and you have piercings in your ears, and they're aligned. So I'm gonna check your nose. Your nose is symmetrical to your face. It is midline. There is no discharge. Can you cover one of your nostrils and breathe in? Good, and the other one? All right, and they are both patent, and you have no drainage, and it is proportional to your face. So I'm gonna assess your mouth. So your lips are pink, they are moist. Can you say ah? Your uvula is midline. Your posterior pharyngeal is midline. Your trachea is midline. Your teeth are intact. Your gums are intact. There's no lumps, no lesions. Your tongue, can you move it up and down? side to side. So your cranial nerve 12 is intact. Everything was pink, moist, and there was no odor. And so now we are going to do your respiratory system. So looking at you, I see that you have no use of accessory muscles, and you do not use any respiratory aids, correct? Correct. Correct. Okay. So I'm going to be listening to your respiratory sound. Okay. If you could inhale for me. Exhale. Okay. Inhale. Exhale. Okay. It's okay. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. All right, now I'm going to be auscultating the back. Inhale. Okay, again. 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 All right, and there are no adventitious sounds and no crackling. Sorry. And you had no use of accessory muscles. Now I'm going to do your cardiovascular system. I'm going to be listening to your carotid artery with the bell of my stethoscope. Oh, you could hold your breath for me, please. Good. Good. And they are 2+ bilaterally, and there's no bruit. I'm also going to palpate them. So, okay. Oh, this one is 2+ bilaterally. And then can I see your radial pulses? I'm going to be palpating them. Okay. And they are 2+ bilaterally. Now I'm going to be listening to your heart sounds, okay? The diaphragm of my stethoscope. Okay, aortic.